Welcome back to Nursing Next. Today we bring you another interesting person, another interesting episode. In 2017, the government of India, through the Indian Nursing Council, launched a new program in nursing titled Nurse Practitioner in Critical Care. And across India, many good nursing colleges started this program. The objective of initiating this program was to prepare a cadre of highly skilled nurses who could provide a competent care to patients in critical care units, who will also possess high end intervention skills. It is a residency program for a duration of 2 years. The characteristic features of this program, being a residency program, it just had 10 to 15% of theory hours, and the rest, almost 75 to 80% of the program hours, are dedicated to clinical learning. So these were the hallmarks of this program. Initially, being inspired, many students got themselves an admission to this program at few reputed institutions who started this program across India. And there are probably since then at least 3 to 4 batches of students who have completed this program successfully. We are here today with one such nurse practitioner, Mr. Yarmatai Raikhan, who completed this program. We want to learn from him what were the pros and cons of doing this program, and more importantly, how pursuing this program has helped such students like him to gain their place in the healthcare setups today. What are the job roles that are offered, and how are they finding their way, and how is it helping the healthcare system? How is it more importantly helping the patients? So, a hearty welcome to you, Mr. Yarmatai Raikhan. I am really looking forward to this interesting conversation.
Oh, I'm looking forward as well.
So, welcome once again. You are the future of nursing, a young, energetic, highly skilled cadre. So, before we get into your journey as nurse practitioner, let's start a little with how you happened to be in nursing, and why did you choose as a higher education the nurse practitioner in critical care nursing program.
So basically, I belong to very backward, I would say, northeastern states, so-called Manipur, which border the Myanmar. So at that point of time, when we finished our class 11 and 12, there were lack of guidance at that point of time. And my family encouraged that nursing has a good potential to go abroad. So basically, from the time I started studying my 11 and 12, my aim was to become a nurse.
Okay.
So that's how I become one.
I think it's very important to note that a lot of students I know in India pursue nursing with an intention of going abroad. So
Oh,
that,
yes.
yeah. And we still face a lot of shortage of nurses in India, although we are the second largest exporters of nurses to OECD countries today.
Correct.
That's an interesting fact.
Probably that's because of financial difficulties that we face at home as well to promote the socio-economic status.
Okay. How did NPCC happen to you? What made you, after completing your B.Sc nursing, choose nurse practitioner in critical care nursing?
Yeah, so basically, after I finished my nursing, I was working as a staff nurse in a reputed institute in Guwahati, which was located in Assam. There, they also started this nurse practitioner course. So they said that there is a course called as nurse practitioner who are specialized in critical care specifically. Would you like to study? I was not so keen because that time I was having some financial difficulties as well. But then as COVID hit, you know that it will be taking a toll on me financially if I start pursuing my process for overseas. So I thought, okay, why don't we study a nurse practitioners, as it is a very good course, very different from being a staff nurses,
Yeah,
as
it
you
was just
research through
a
it.
new program
It's a
that
news
was
program.
launched.
So let's just go through it and study it. It took me actually 2 years because I did not know when did the course start, which colleges provide these courses. So fortunately, I came across this reputed college in Bangalore which hired me. They took a small interview and they said, okay, you can come in, but you will be the first batch. Would you like to study? So I said, yes, I'm more than willing. So fortunately, by God's grace, that's how I landed up in Bangalore.
And how many students you were in the first batch?
Oh, it was only two.
Two
Two
of
of
you
us,
joined
yes.
as NPCC
NPCC, yes.
students.
Yes.
Okay. So as we know that the NPCC program is very less of theory and lots of hands-on clinical skills, learning, patient assessments. So could you just give us some insights as to how did you find going through the course, the program?
As I was the first batch, my teachers also, it was a trial and error learning for us as well, because this was very new in India. The concept of being a nurse practitioner, how does it become different from being a staff nurse? Why does it is called residency course? So all these things were a confusion for us as well at first, but luckily the college guided us so well. We had guide and a go guide where the research and the managements were guided by the nursing professors, and the clinical guidance, including the assessment, diagnosis, and treatment of the patients, were being guided by the doctors as well. So yes, it was thrilling journey, but I feel like I have never studied so much in my life when I was studying there. Not like how we studied in B.Sc nursing and all. Yeah, that's my experiences.
So what were some of the very special skill set or high-end skill set that you learned under the guidance of doctors who were mentoring you?
So we learned how to put central line, how to intubate the patients, what are different technique that you use during intubations. So we were exposed to different departments. So we work in medical ICU, we work in neonatal ICU, we work in PICUs, we worked in surgical ICUs as well, and we work with some few anesthetists doing PACs as well, pre-anesthetist checkup.
Okay.
So you gain a different skill set which will help you in our day-to-day activities once we passed out of the colleges. So some of the few things are intubations, central line, yes, and ICDs. So these were the few things. Even they asked in my exams, which was held in St. John Medical College by the internal assessors, who was the HOD of the neuro ICU as well. So
Were
and
the doctors also examiner, part of an examination team?
oh yes, there was this one. He was the HOD of, I think, neuro ICU, if I'm not mistaken, and there were some nursing professors who were also an examiner. So our exam was located there, and it was tough. It was very vigorous. We need to examine the patient. All sorts of OSCE questions, where OSCE methods of exams were implemented for our practicals, which was a tough one. So interpretations of PFTs, ABGs, ECGs, the mechanism of actions of different types of drugs that are commonly used in ICUs, arterial lines, clinical questions, assessments, interpretation of blood investigations. All sorts of questions were asked in my exam. Yeah, it was a tough one, but yeah, I would say a memorable one, and it was a life-changing experience for me.
As a student coming from B.Sc background, how easy or difficult it was to really learn these skills, or
Oh, it was tough. B.Sc, you listen to whatever the doctor have advised and do. From that stage to looking at the patient different ways, such as assessing the patient. So we have a subject where we have to know all the types of assessment: respiratory, cardio, renal, endocrine as well. All these assessments
System-wise.
is system wise, which is very elaborate as a separate subjects.
Yeah.
So that was one thing, and at first, even escalating a sound, like let me describe it for you, like in a respiratory examination, what types of Krebs that you generally hear. It may be a fine Krebs, coarse Krebs. Which conditions does it generally come? If it is an inspiratory Krebs, which conditions that you have to look at? What is your differential diagnosis? Were all very new to me. But fortunately, I have a very good guide who, guided from the basic background, suggested me a good clinical examination books to learn all these steps, and I'm forever grateful to them.
So it looks like the journey of doing the NPCC program had been tough, but at the same time very satisfying and a rewarding experience in terms of growing as a professional.
Yes, oh yes. It was a very satisfying, and it was a very new experience for me to learn all these skills set. I think, yeah.
Yeah. So I'm sure once you learn this kind of things and you completed your course successfully in 2023.
Yes,
Yes,
I finished my course in 2023.
So maybe you are out with a lot of aspirations now that you've learned your skill for so many things. And how was it? Because it was a new course. Not many people probably knew about it, even in the job market. So how did you find your first job?
It was a funny experience, at the same time a hectic one, because we felt that as specialists from ICU, people would hire us instantly, and I was asking for a lot of packages. That's what we have in our mind.
Yeah.
But hunting a job was not easy, because if you look at the healthcare setup, people look at the low cost and how good what you will give us in return
True.
for paying you that much amount of money. And yes,
I think absolutely this point, I think all the aspiring nurses also need to really focus on कि people out there, employers in the market are not interested paying you, but they are interested more in knowing what is the kind of service value you can offer to them.
correct.
Yeah.
So I actually approach a lot of human resource department in different hospital sectors in and around Bangalore. I did look up in LinkedIn as well. I applied jobs. I called them back. I was struggling a lot. I think I went to more than 10 hospitals, in fact. Fortunately, at last, I was dejected. I said, why did I even study this course? Then, fortunately,
You were looking for a title of critical care
Yes.
nurse practitioner position.
Yes, they said you can work as a staff nurse or an in charge nurse. I want the title of the nurse practitioner specialized in critical care or ICU specialist, which none of the hospitals were willing to provide. At the same time, they don't know what I do or what I can give for the hospital.
What was their response like when you said you had to go around 10 hospitals?
Sorry, sir. Unfortunately, there is no vacancy available for nurse practitioner. And probably when there is a vacancy for nurse practitioner, we would call you. So there were few hospitals that were hiring, but I would like to venture out to the other hospitals so that they get to know what we are capable of as well. So there was a hospital in Bangalore that I approached, Philomena's hospital. The medical director, the administrator, they were quite inquisitive about what I can do for the hospital. And yes, it's a very old hospital, as you know. I told them what I can do for the hospitals and for the patients that is there. Unfortunately, yes, they were very accommodating to see what I could do for the hospital. And yes, now they like me very much by God's grace, and they were very supportive of what I can do for the hospital, and I'm forever grateful to them.
So you got your first job at St. Philomena's, finally.
Yes, finally.
And did they give you the title of nurse practitioner in critical care?
The medical director asked what title you want. But I said I want something which has an intensivist in it. So I said nurse intensivist. Basically, it's an opposite name of critical care nurses. But because in India, people look and listen to the sound or the designation that you have. So if they say you have an intensivist, so basically, oh, intensivist. So basically, I label it that way so that people will be more accepting of me as well. So that's how I give the title in that hospital. But
Your
whenever
suggestion was nurse intensivist.
yes, nurse intensivist. But whenever patient ask, saying, "Oh, Mr. Matai, you're so confident. Are you a doctor?" Then I would explain to them, "No, I'm not a doctor. I am a nurse practitioner by profession, specialized in critical care."
I appreciate that. I appreciate that. Yeah.
So there are few patients that have asked me this, yeah. But then I did say to them and correct them, saying, "Yeah, I am a nurse practitioner specialized in critical care."
So
Yes.
how was their reaction then? The
Oh,
patient's reaction?
some patients they are so like taken back and they said, "Huh? You are so confident in doing whatever you do, and I thought you were a nurses from morning onwards. I have been observing you." This is what they say. Yeah, these were the experiences and the response that I got from some of the patients.
Going back to your struggle of finding a job, did you not try in any government organization?
Oh, at that point of time, the Indian government were not having any job vacancies or opportunities for us at that point of time. So it was a difficult
So you mean
situation
to say there
for
was
us.
no cadre created?
Yes, there was no
For
cadre created from the government side. They have
government
just
side.
implemented this job. The college, they have started this teaching us, but cadre was not there. Even in the government sectors.
I think we want to pause here and probably just a message or a request to all policymakers who are watching this conversation that I think it's very necessary once we create a program to create position
Oh, very true, very true.
in the government first, because unless government leads and creates an example, the private is not going to follow.
True.
And of course, majority of healthcare happens today in private sector, but then leadership at least must be at a government institution. So it is, it's hard to hear your struggle finding a job, that there were no openings in government. You had to kind of try your way out finding a job in private. But finally, I'm happy that you made it. I think I credit that as your own grit to succeed finally. So very well done, I must say. Yes. So can you give us now insight? You said you always introduce yourself as a nurse intensivist, something to your patients. But how did your patients find you in terms of your skill sets? How did the other doctors? I'm sure, like, since it was a new position, it wasn't that easy for you to be accepted by even the other doctors who are working in the ICU, the nursing staff, maybe other healthcare team members. So how was it in the beginning days when you went there?
Oh, as soon as I entered the ICU, nurses were very accommodating actually.
Okay.
They looked up to me. They know that okay, you're so skillful. But the doctors, it was very new for them of what I can do, what I cannot do, what will you help us with. Uh, at first, yes, the intensivists, even they do not know what I would do for them. So as I am in a critical care sector, we work together as a team, and fortunately, my boss, who is the HOD of Saint Philomena's Hospital, as he was working in the US, he had been knowing what nurse practitioners do. They can independently assess, treat, and diagnose the patients, which will take a little bit of time for India to accommodate all this in our policy system. But yes, he start training me in a different way because I am venturing out to treat the patients now. So as a critical care specialist, what are the things that you have to be an expert in? So he pushed me. So let's say I did know a little bit about ventilators, how to use it, but extensively of how I am knowing now, I was not how it was then. So every day I have to come and look at all the ventilator setup, how to do a ultrasound scan of the chest, POCA scan of the abdomen. Yes, radiologists are there to take care, but an instant scan where radiologists are not available, you need an instant diagnosis, probably a differential diagnosis on how to go about it. He pushed me to learn all this, and probably we'll have a discussion sometimes in the bedside. where how do you approach patients, what are the different ways and aspects that you have to look at, because critical care is not only about treating the patients, and that's where we nurses also come in, because we have been looking at the nurses holistically. So critical care also, like, it's an empowerment for me, because we have something called as critical care pathway, where you have to look at the patient holistically. Probably you have to respect their spiritual aspects, but at the same time you have to look at them in their nutrition, in their medication aspects,
True.
in their physiology aspects. Probably the book may have given us differently on how to treat the patients and guide us, but then basically it is the anatomy and physiology which we have learned, where we are going to hit at that point. So in that aspects he enlightened me a lot. But yes, it was very new for the doctors from other departments to look at, but the intensivists were very keen on accepting me, and I'm you know uh, grateful to them for that. Yeah, that's what I would say.
Okay, so how was your typical day, like work day? Now you've been working for 3 years in the same place as a critical care practitioner, or rather nurse intensivist, the way you title yourself, christen yourself, I would say. New title was born. So how was your typical day like, and if you can share some memory of work that you did, you felt very satisfying or rewarding.
Okay, so there was so let me just start with my typical day of how my day to day goes. So whenever I come to the hospital, probably the PGs update me whichever patient is sick. So we work as a team, and the nurses will say, sir, this patient is bad. But at the same time, I look at all the patients. So probably I look at the vitals. So I'll just go one round of
How
all
many
the
patients
ICUs.
were there in that ICU?
Yes, we do have 24 bedded ICUs.
24.
Yes, 24 bedded. So I look at all the patients in the ICUs. So I look at the vitals, the way they breathe, the ventilator settings, if there is the settings are being set correctly, what are the ABG values, the blood investigation values, whether these patients will need intubations, whether these patients will need central line. It's not that the doctors are not doing their job, but at the same time they are so busy. Sometimes ICUs are full, so their plate is also full. So sometimes we help them look at the patients in a better way. So as I said, it's a teamwork in ICU.
Yes.
So if there is any patients that will need central line, or that needs an inotrope support, or there is an arterial line, we discuss whether that's a need, and we update to our senior intensivist and consultant as well. And they never say no. If we feel it is right, they trust our judgment. Yeah, this is my typical day. And then probably if some patients we suspect, let's say a pyelonephritis, we did a POCA scan, obviously we'll come to know. If you, let's say one patient, x-ray looks a little bit okay, because sometimes the x-ray may not give you a clear picture, then we do this one fast lung ultrasound to see whether there is any effusions, consolidations, atelectasis, or curly A, curly B lines. So these are very easy in ICU, because I think most of the ICUs have ultrasound. Even ours we have. So we can just do it and we'll get to know. So if there is any consolidations, no antibiotic has been added, then we talk to our intensivist, sir, can we add so and so medications? And yes, they used to listen to our whatever we are suggesting as well. So this is my typical day. Yes. And then I review at the medications. Let's say, like, we have taken a blood culture, and culture has grown so and so. So which antibiotic will be the most appropriate, and how do you know that this antibiotic will be appropriate for this condition? And yes, in our hospital, fortunately, we have something called as antibiotic stewardship program, where because it's a teaching institute, we have certain guidelines. So depending upon the guidelines, we'll discuss with the consultants, and we'll add the antibiotics.
WHO is very much
Yes.
focusing on antibiotics.
Because as you know, India, we have a lot of antibiotic resistance as well.
Yes.
So yes, so I did learn a lot from the consultants who are putting those, and what type of antibiotics. And yes, in our college days when we were studying NPs, we do have all the antibiotics. It was a very big chapter in pharmacology where we learned. So yeah, We know now we have to collaborate with the anatomy and physiology and pathology of the patient, and we have to add
Yeah,
antibiotics.
it's an amalgamation of whatever you've learned
Yes,
from different
yes.
subjects, you bring together to make the jigsaw puzzle
Oh yeah.
solved, that what this
Correct.
is like. So I mean, it's very impressive
Yes.
to learn what skill sets through your studies and through your 3 years of experience you've acquired. Uh, right, you said when you were discussing that there are sometimes ICUs are overcrowded. We have shortage of doctors, and more so, I think India is currently in crisis of shortage of doctors more in rural areas.
Oh
So
yes, I think they can implement this nurse practitioner and critical care as an ICU specialist in rural areas. I did find recently the Indian governments, they are trying their best to help the rural people where the healthcare sector has not reached properly. So there is something called as then bedded ICU, which is started by the philanthropists of Indian big companies, where they'll invest and provide ventilators and ICU setup, where they plan to provide then bedded ICU for every district hospital in India. So yeah, I think we are trained under an intensivist, so you can pay us and in a lesser amount, and we can go work there and work collaboratively with the MBBS doctors and train the critical care nurses, and provide them with the best care that we have learned in the tertiary sector in the urban areas. So this is what I would like to suggest the government as well. I mean, this would be a
I would
good
actually
initiative.
go a step forward and say that every district hospital that has an intensive care beds
Yeah.
must hire an NP in critical care nursing.
Oh yes.
And that probably helps to provide, I mean, hearing you, we know what kind of niche skills uh, critical care practitioners have acquired, and that had really come to a great help of people in
Yeah.
rural setups. So I see a big avenue there for improving the
Yeah, I think
healthcare
it's
system.
I think it's an untapped potential, I would say. If you utilize the
Absolutely.
opportunity that is provided,
Absolutely.
we don't need to look at the other countries.
Yeah.
India is everything, I would say.
Yes. Now that you just brought in the topic of pay, how has been so far? Are you satisfied with the earning aspect of yours?
I can still earn better, I would say.
Yeah, of course.
Yeah, but I think we don't need to demand as much as how the other super specialties demand. But yes, they can increase our pay a little bit, because in the end, most of the nurses who are highly skilled, with the skill that they have learned from the Indian setup, they're all going abroad. So probably we may not be up to the par of how the European countries and the Middle East countries are paying, but we can at least improve the pay that the nurses are getting in India. This is what I would suggest.
Absolutely, I do agree with you. I mean, we cannot compete with what US, UK, other European countries are paying. But then India needs to have its own standard. Probably as of now, we don't have that standard set for nursing cadre itself for their payments. I mean, we don't have it for the nursing officers. We don't have a specialized cadre like yours. So I think there's a great work still yet to be done there, and that's how probably we can retain a lot of our skilled nurses in India, which we are in much need of, I believe.
Yeah.
So
Hopefully, the policymakers and CEOs or the hospitals owners will recognize it. That's what I would say.
yes, and it's for a greater good of patients finally.
Yeah.
Ultimately, what benefits public is something that will survive, that will go in a long way.
Yeah.
And
Basically, down the road, it's all for the patient benefits. That's what I would say. Low cost, effective care. So this is what I would say.
You never had a thought of moving abroad?
I did. But there was. Let me just elaborate you a little bit on this. I was actually planning to go to US, but in this process, actually, some of my intensivists who have worked in the US and my friends from US, they told me that India is a land of opportunities. People used to say US is a land of opportunities, but he says that India is a land of opportunities, and it is an untapped potential.
Yes.
So I thought for a second, yes, India has given me so much.
Mm.
So why not I give it back to the country that I have learned a lot from? And there were a few doctors that says that yes, we will help you in whatever resources that you need and whatever guidance you need. So yes, that's the reason why I did stay back now.
Great. I wish you stay back and you don't leave India, and India benefits out of people like you. For that, I think we need to, as a government, as country, recognize the values of specially trained nurses like you.
Hopefully.
Yeah. So, what you think that probably if you have to kind of request or put it forth to the policymakers today, how could they facilitate? Uh,
I would say empower the nurses to the best of their abilities.
How? What are some of the things that they could do that would really empower?
So probably put clear cut guidelines on a legal framework for people like us, so that we could practice better to the, and we could give our best care to the patients. That's what I would say.
Maybe also create a cadre in government itself for jobs.
I wish.
That would lead a way.
Yes,
and
that would be great.
Yes.
There are some news that I get it here and there that they have created a cadre for the nurse practitioners, but then the payment, the work that they are doing right now, I am not so sure until
Yeah, I think
about
that
that
there
as
needs
well.
to be cadre, there needs to be a scope of practice,
Yes.
there needs to be the pay framework, there also probably needs to be the support system for facilitating such practitioners.
Oh yes.
I think there's also a cultural change that is required in healthcare systems like hospitals for having more acceptance of nurse practitioners especially.
Yes.
I think one good example of this thing working well, nurse practitioner program, I see it in Narayan Rudayala, where Dr. Devi Shetty actually was a pioneering person.
Oh yes.
Who started
he was one
this
of the and he's
and,
very supportive of nurses. I really appreciate him. Hats up to him.
Yeah. But then his has become a very isolated example. Only in Narayan Rudayala it's been working well. I cannot see that elsewhere working that well. So we need to facilitate the change in at least similar manner. Probably.
Yes, I think I would say that yes, our corporate sectors, the hospitals, even the trustees and all. These trustees, the semi-government hospitals. These are the places where we have reduced manpower. So like staffs and the employees are overworked. So you can hire us. We will take care and provide the best effective care that we can with our caliber that we have learned. This is what I would say.
You envision an opportunity for a nurse practitioner to be an entrepreneur?
Pardon?
Do you envision
Okay.
an opportunity for a nurse practitioner like to be an entrepreneur or start their own businesses?
Oh yes. I envision it, and now I'm starting one.
Okay. Since you are just in a beginning phase, I think we'll keep that conversation for another day.
Probably another day.
Another day. But I just want to give the audience insight that it's not just that you became a practitioner, you will do only in the hospital critical care units, that you can expand your boundaries of imagination of your work.
Oh yeah.
Yes. So great, Yarmatai. I am truly enlightened, fully impressed. People like you keep the hope alive. I can say that nursing will do great for the benefit of people of this country,
Of course.
and we reach every person who is in need of our care through whatever our skill sets. So coming to last part of this podcast, making it more interesting, we have a short rapid fire round for you.
Okay, I'm nervous now.
So I'm going to ask you a few questions, and you're either going to give me answer in one word or one sentence.
Okay.
Ready?
I'm ready.
Okay. So one quality that makes a great nurse practitioner.
Holistic care that we provide.
Okay. One misconception people have about nurse practitioners.
That we are staff nurses.
So you don't have any higher skill sets.
Yes,
You're just
yes.
similar to a staff
Yeah.
nurse. Okay. One policy change you want immediately for Indian nurse practitioners?
Probably
Most critical one.
most critical one.
Mm.
Put a clear legal framework for now. That's what I would say.
Okay, great. What is the value that nurse practitioners bring in hospital which the hospital managements have not recognized yet?
Cost effective and high quality care for the patients.
Absolutely. If you could change one thing in healthcare overnight, the entire country's healthcare system overnight, what it would be?
Probably I will look more on the preventive aspects of our healthcare system, because including the patients and the patients that are being admitted in ICU, they came in the last moment due their financial difficulties or sometimes because of their lack of educations, which is very different from the Westerns, the way they approach on the disease conditions.
So focus
So,
should be
yes,
on
focus on-
prevention
yeah.
and early detection.
Yes.
Early detection.
I would invest a lot there.
Yes, yes. Why should India invest more in nurse practitioners?
Okay. Because we can give you an effective, a cost effective, high quality care, and probably that's it.
And probably an accessibility, better accessibility.
Oh yeah, accessibility. Yes.
Yes.
If we are in rural areas, probably
Yeah.
patients will get benefited a lot with the
Yeah.
highly
Yeah.
skilled,
Yeah. I think,
specialists like us.
if we do that, we will be more close to achieving the universal health access,
Probably.
healthcare goal of
Yes,
what
of our
WHO
Indians,
is. Yeah.
vision and the WHO vision
And also closer to achieving the SDGs targets that we have
Yes.
set in.
Correct.
Right. So it has been an absolute pleasure, a lot of learning, and I'm sure for the audience, a lot of inspirational experience listening to you. Thank you so much for sparing your time, sharing your journey, the good part of it and the tough part of it. I think everything has its own lessons, and it makes us wiser in life, and maybe even refined in a way. So thank you once again for being here and sharing this all with us. To our audience, if you're still watching, I'm sure you truly enjoyed listening to this conversation. The young aspiring nurses, you truly today, maybe for the first time, through the through our podcast, you met the nurse practitioner nursing. You learn what they can do. To the policy makers and the hospital trustees and the owners, you probably today learned what value a nurse practitioner can offer for your hospitals, for your healthcare systems. And to the country's policy makers, my request would be, please empower nurse practitioners, not just in critical care, but I think there are many other areas, and probably next one to go would be nurse practitioners in public health. So thank you very much. Please do like, comment, share your thoughts, subscribe our channel, and spread the message among your networks about this podcast. Thank you very much. See you again with another interesting guest on our show.
Thank you.